And good afternoon, everyone. Thank you for joining us as we bring this week to a close on this Friday and provide you with the latest information on COVID-19 and its impact here in Orange County. This discussion will include information on the process the mayor will outline with regard to the task of reopening the county. With remarks and updates today in this press event are our mayor, Orange County Mayor Jerry Demings, the mayor of Orlando, Buddy Dyer, Dr. Raul Pino, Health Officer for the Florida Department of Health, and our Sheriff, John Mina. With that, we will go to the Mayor of Orange County, Mayor Demings. Mayor.
Okay, thank you, Dr. Williamson. Thank you to all of you for being here this afternoon. We have extended the emergency order here within Orange County for another 7 days. We made that happen earlier today. As we began the week, we said that there will be 3 priorities for us this week, and the number 1 priority would be to stop the spread of the COVID virus within our community. Number 2, it was on increasing the testing that would be done in our community. And lastly, we will begin the planning process for phasing the reopening of business here within Orange County. We have gotten about that throughout the week, and I have to kind of give a backdrop of where we are currently here in Orange County and what we are experiencing. Today, Orange County has 1,135 coronavirus cases, and sadly, 21 individuals have died of the virus here within our county. We have tested approximately 15,000 individuals within Orange County. The heat maps have been updated, and as I have been saying over the past few weeks, nearly every zip code in Orange County has at least 1 case of the coronavirus. As a reminder, on Monday, this coming Monday, April the 20th, the state-run temporary COVID testing sites will be activated. It is important to remember that these sites are by appointment only. Residents must call and get their appointment in order to be tested. Dr. Pino is here with us today, and he will give you more details about the various testing sites. It has now been a month since I initially issued the stay-at-home order for Orange County residents. During the past 4 weeks, I have been extremely proud of how our residents have been self-isolating and helping to slow the spread of the virus in our community. However, I want to ask everyone to keep their efforts in place. Please wear a mask when you are in public and limit your exposure to others. Your elected leaders are working hard during this time, along with our healthcare workers, first responders, and others who are engaged actively in this fight against the pandemic. We look to have a plan in place soon to determine the reopening of businesses here within our community. We've never dealt with anything like this pandemic in the history of our country. There's no roadmap. There's no template that we can follow. My priority is to find a sweet spot to get people back to work while keeping our residents safe at the same time. There will be highs and lows while we work toward this goal. My decisions will be based on the best information available to me at the time. I will consult with experts from the CDC, from our local hospitals, and state and local leaders from a variety of sectors for a response that makes both scientific and business sense. I don't want to reopen too quickly and then have to shut back down for another period of time, doing further damage to our economy. We don't want the invisible enemy to return. I'm announcing that the Orange County Economic Recovery Task Force will be chaired by George Argale, the president of Visit Orlando, and Tim Giuliani, the president of the Orlando Economic Partnership. They will head up a group of nearly 50 individuals representing such areas as our theme parks, hospitals, financial institutions, hotels, plus many small business owners. We're also including representatives from Lake, Osceola, and Seminole County, along with those here in Orange County. All of the individuals and their companies represented on the task force have been greatly impacted by the stay-at-home order, and many were forced to shut down. These are some of the best and brightest minds in our community and will work with a single goal in mind. The group will come up with recommendations for reopening Orange County, including the approach to easing restrictions while ensuring the safety of employees and the public. We want to make sure our residents feel safe enough to venture out in public and return to some sense of normalcy. I realize that in the coming weeks, we must instill confidence in people to feel comfortable re-engaging publicly. The first meeting of the task force will be a virtual one on Wednesday of the coming week. I'm optimistic we will be able to get Orange County and Orlando, the metro Orlando area, on the way to economic recovery while breaking the back of this virus. For struggling businesses and employees, there's another place to go for assistance. Visit Orlando launched a tourism help hub website to connect the area's tourism-related businesses and workers to vital information to navigate the crisis. The site includes research, business data, financial resources, job listings, food support, and deals that apply to many different businesses and individuals who need help in the metro Orlando area. 41% of the region's workforce is related to the tourism industry, and the Tourism Help Hub will provide assistance to those who inquire. The website is visitorlando.com/help. visitorlando.com/help. My office has received several inquiries about our animal shelter and how the pets are doing. On Thursday, the Orange County Animal Services began virtual adoptions on their Facebook page. 15 cats and 5 dogs are available to go home with a caring family. So far, 74 people have inquired about these virtual adoptions. The majority of these pets are in foster care, and the shelter will help arrange virtual meet and greets with the foster parents. If it is a match, Animal Services will process the adoption paperwork electronically and coordinate a quick pickup of the pet at the shelter. Go to the Orange County Animal Services Facebook page for details. So hopefully that's a bit of good news for you here in our community. At this time, I'm going to ask Mayor Dyer to come forward and share additional comments.
Thank you, Mayor Demings. As we continue to use our collective strength to get through this pandemic, we're also working on how together we can use that same collective spirit to move ahead to a new normal in the coming weeks and months ahead. It's going to be critical as we create our plans to get to our new normal that they be done in ways to continue to keep the rate of infection down. They must be done strategically, based on facts and science, and in a way that does not undo all the good that we have accomplished so far together. So as we continue to respond to the impacts of COVID-19, getting critical data and getting that information out to our community must continue to be our top priority. To further that effort, our City Information Technology staff has been working with data provided by the Florida Department of Health to build an online platform that provides the latest information on positive cases of the virus here in the city of Orlando. As a city, we have put that data at the fingertips of our first responders so they know immediately when they may be responding to an area that has a positive COVID-19 case. It allows them to take further precautions if necessary as they make contact with our residents. And we want to ensure that our Orlando residents have access to that data and the most up-to-date information. And that's why we're launching this online platform. City of Orlando COVID-19 Data Tracker. We're launching that today. You can go to orlando.gov/data tracker. It includes information on the total number of COVID-19 positive cases, citywide and breaks it down by cases by neighborhood. It also includes citywide neighborhood maps showing areas where the positive cases are more concentrated. To keep the information current, we will update the data tracker every Monday, Wednesday, and Friday as we receive new data from the Florida Department of Health. And even with this data, I want to continue to remind residents that regardless of where you live in Orlando, you must continue to remain diligent and stay at home. Continue to follow the CDC guidelines, including regularly washing your hands, practicing 6 feet of physical distancing, and wearing face coverings. As more testing sites are opening and our access to data increases, we are absolutely seeing that the evidence of our community and what they have done has flattened the curve. But we can't lose our focus. The progress we've made is a direct result of the actions of every person here in our community. And I want to thank the residents of Central Florida, Orange County, Orlando for their efforts in this. But we can't abandon our commitment now. We can't give up on what's working. And together, we will determine our path to a new normal, reopening our economy and getting people back to work and businesses opening. We all want to get back to work, to our new normal, but we have to do it responsibly. And we are still in the middle of a healthcare crisis. We don't want to go backwards, but continue to move forward. So our new normal will be a different place, but we will get there through our collective actions as we stay together each day. We are Orlando Strong, so let's keep staying strong, staying smart, staying safe, and for now, staying home. Dr. Pino?
Thank you, Mayor. Good afternoon. As Mayor Demings mentioned before, the county has 1,135 cases for a positive rate of about 88%, which continue to stay in single digits. I also want to call your attention to the graph and data behind us. And it is important to realize that although the majority of the cases in the pandemic in Orange County are on people younger than 65, most of our deaths, by a big majority, are on people who are 65 and older with pre-existing conditions. So this disease is deadly for people who are over 65 and have pre-existing conditions. That's why it's so critical to continue to maintain isolation, social distancing, and protecting the most vulnerable. We have 21 deaths, 3 new deaths at least that we are running, and of course our prayers and thoughts with the family and with everyone that has been affected. With regarding to race, 45% of the individuals are Caucasian, 12% of all the individuals affected are Black, 26% are other, and about 17% with another race. With regard to ethnicity, about 27% are Latinos, and about 33% are non-Hispanic. We don't know the ethnicity for about 40% of the cases. And although you probably will ask yourself, well, how is it possible that all the data is not there? When you have multiple sites collecting multiple data points from different companies and different labs, and then coming into a centralized point, it has to go through a cleaning process to be able to certify those absolute numbers, but that's the closest that we have right now. In partnership with the City of Orlando and the county, we are about to launch on Monday a mobile testing initiative that is going into the communities, and that's going to be the true testament of how the pandemic is how it's happening in our communities, because we will go and try to reach out to people who are normally not connected or engaging with the healthcare system. We are in a position right now that our response is well organized, that we can do that, get out of main sites and go into the community. We have initially assessed this going to be done in 5 different sites. Monday on J. Blanchard Park, Tuesday on South Econ Community Park, Wednesday at Camping World Stadium, Thursday at Barnett Park, and Friday at West Orange. People will need to make appointments. We still have appointments. In most days, we still have over 100 appointments available for all these days. Please call our health department at the phone number 407-723-5004. Make an appointment. If your call cannot be answered or you answer during the weekend, leave a message. We will call you back. On these sites, we will be taking walk on foot people who may have an appointment, cars and bikes. With that, I will answer any questions after Sheriff Mina, who I am passing the microphone and didn't forget this time.
Thank you, Dr. Pino, and good afternoon. So last week, we told you about our special response team that is called upon for incidents involving those who may be affected with the virus. And these deputies are specially trained and have additional protective clothing, respirators to help them lessen the risk of exposure for the rest of our deputies. So the team has responded to over 10 incidents since it began last week and doing a great job in enabling the rest of our deputies to stay safe. So we believe it's one of the reasons for such a large law enforcement agencies that our numbers have stayed relatively low, and that in addition to measures that we put in place to keep our law enforcement here safe in Central Florida. Unfortunately, law enforcement throughout the country are encountering people claiming to have been infected with COVID-19 who attempt to weaponize the virus by coughing or spitting in first responders' faces. This is just a reminder to our public that this is a crime. In fact, there are 5 criminal statutes that can apply. They're all felonies ranging from assault on a law enforcement officer to aggravated battery on a law enforcement. And so the U.S. Attorney's Office here locally has also notified us that they will adopt those cases federally. So even making the threat that you have COVID-19 and spit at an officer or deputy is a third-degree felony. And so additionally, if our citizens encounter this dangerous activity, we want to know about it, and we will investigate those cases. Another unfortunate byproduct of the pandemic has been a surge in COVID-related scams. While our agency specifically has not seen this, I want to offer some general warnings about scams, and these can range from someone offering coronavirus tests you can minister at home to scam text messages saying that you've come in contact with someone who has been infected, prompting you to click a link to learn more. These are not messages from any official agency. I just want to make that clear. They, however, are a gateway for criminals to steal your identity and gain access into your bank account. The Florida Attorney General's Office has a lot of good information about how to avoid and report these scams on its website. That's myfloridalegal.com. So as we continue to face the challenges of COVID-19, I want to assure you that we are doing all we can to increase the safety and readiness of our law enforcement so we can continue to keep our community safe. That brings me to a warning about speeding. The roads are a lot less congested, as you have noticed, and that has led some in our community to treat our roadways like their personal speedways. This is extremely dangerous for yourself and anyone who must share the roadways. I'm told the top speed that our deputies have recently was 126 miles an hour in a 70-mile-an-hour zone. And just so you know, that's a $1,104 citation. But more importantly, that kind of speed could have led to a fatal crash. So, you know, we appreciate everything Orange County residents have done to protect themselves from COVID-19. Please continue to stay home unless you must go out. Please wear your mask if you're in public, wash your hands, and practice social distancing. Now is not the time to let our guard down. We're doing such a great job. We must do everything we can to stop the spread of this deadly virus and get back to our new normal. And so many of you seen a lot of the local law enforcement agencies have been spending a lot of time thanking our healthcare workers. I just want to reiterate that we can't thank them enough. They're on the front lines with us, exposing themselves to the deadly virus at risk to their own safety. So we also want to give a shout out to all of our grocery store clerks and all those who are providing food and those essential services as well. Thank you. This time I'll turn it back over to Mayor Demings.
Okay, if there are any questions, now would be the time to ask the questions.
Lauren Seabrook, Channel 9. Sheriff, actually my first question's for you. There's a large gathering outside, a protest going on. Why are they being allowed to be in a big group like that?
So that's the right to protect free speech. That is a free speech area, and just like any other protest for any other thing, political or otherwise, people have the right to free speech and to protest.
Okay, and then Mayor Demings, we're hearing from some people throughout the county that you were talking about trying to open things up in June. Is that what your timeline is looking at, or do you think earlier than that?
I can't say precisely when we'll have a phased reopening. That really is the purpose of the task force that I announced today, is to really work together collaboratively across the various industries and work with our healthcare experts to come up with a reasonable period of time. And as I said in my comments, that decision will be based on the medical science and what also is business friendly as well.
For Dr. Pino? I know you mentioned the appointments. I think you said there's 100 appointments available still. Are you expecting those to fill up? Are you surprised they haven't filled up already? Do you think the message is getting out to people that they need to have an appointment?
So when we initially set up the sites, I was not really expecting to get 300 calls for the first few rounds. And I mentioned it to our staff. I think that, I could be proven wrong next week. And I will hear that, but part of the issue is that the work that you guys are doing, putting these sessions in live, all the media that we have done, the county, the city, the health department, I think that people are getting the information they need. And in mild cases, testing doesn't have any impact, really. The impact is in social distancing, washing your hands, keeping your distance away from people. And as I said before, we have to assume that everyone won't have it if we want to eliminate this.
Dr. Pino, this is for you. Eric Sandoval with News 6 and ClickOrlando.com. There's a case, an incident developing in Tampa right now involving an assisted living facility where several people have come down positive, 3 people have died. Is the Department of Health here in Orange County doing anything targeting these assisted living facilities as far as the COVID spread? And if so, what?
Yes, so the assisted living facility is one of the 5 priorities for the state health department. Initially, they were all visited by strike teams, probably like 2 weeks ago, to have an assessment of their needs and also the infection control measures that they have in place. The CDC developed specific guidelines for places of assisted living facility and other type of congregated housing. And also, right now, every time that a positive case has happened in an assisted living facility, we are supposed to conduct a visit with ACA together so that we can address again in that specific location the needs that they have and infection control measures in place. The county has provided as much as they can with PPE and other protective equipment, and we are really watching these facilities like hawks. I'm watching for the cases and being able to contain, not only because what is happening in Tampa, but also what happened in Washington. So we don't want to repeat that. If you imagine what I was saying before, most people who live in these facilities are over 65, and most of these people have serious health conditions. So it's critical that we protect them.
Do you have the manpower to handle it?
Yes.
All right. This is Melissa Thomas of Florida National News. This question is for Mayor Demings. We understand what you're saying in terms of the staggered timeline, but do you guys have a plan for if you guys should get pressure from the President of the United States, since he's pushing to reopen the entire country pretty much by May 1st?
Well, I know that the President announced, I guess it was yesterday, a phased approach where there would be, the early phase would be indicative of businesses reopening, but still having some type of social distancing restrictions with 10 or fewer people. Then the next phase would move to 50 people or less, and then the third phase will be trying to return to some sense of normalcy. However, each state each governor has the authority within their respective state to implement whatever the regulatory mandates may come out from the federal government that the states will take into consideration, make their own state mandates, and then all of them will get implemented at the local level. So what we are trying to do here is to ensure through the Orange County Economic Recovery Task Force that whatever happens here in this community is unique to our community and it is appropriate for our businesses here. So you will see that tiered approach. The purpose of the task force is to make a determination of the right fit for reopening here within our community using a phased approach. That plan will be developed in consultation with the group, and we'll be happy to provide you with the list of individuals who represent various small businesses, corporations, et cetera, and other, I think, business assistance entities as we move forward. Okay.
Steve Hudak from the Orlando Sentinel. This is for you, Mayor Demings, but I would also be interested in hearing what Mayor Dyer, Sheriff Mina, and Dr. Pino have to say about this. If you had an opportunity to talk to the people who are out front and saying this threat of this virus is exaggerated and that the implications of financial harm is greater than the health consequences, what would you tell them?
You know, you see what's going on outside. In my humble opinion, it's much of a circus. Perhaps one person has the right to risk their own health and safety, but they don't have the right to risk the health and safety of others. From the observations that I had earlier of photographs that were shown, these individuals were taking it lightly. They were not masked up. They were not practicing any form of social distancing. And I think that's a tragedy, particularly since we know that 21 people in this community died from the virus. I wouldn't want to play Russian roulette with myself like that. We know that over 600 people in the state of Florida have died as a result of this virus, and hundreds of thousands across the globe. So it's not fun and games. This is serious stuff that we're dealing with here in this community, and so I would suggest to them to take it seriously.
Thank you.
So there are some people that don't accept science or facts, and I suspect that's a bunch of them that are out front, but what I'd probably do is suggest that they have an opportunity to speak with family members of somebody that has died from COVID-19. Maybe that would wake them up a little bit.
I'll just echo what both mayors have said. I mean, we've seen the data, we've seen the science, and again, I've said this earlier in other press conferences that we talk about all these numbers, but those are actually faces and names and relatives of real people that have died in this community, and people need to take it seriously. We wouldn't be up here every other day, you know, updating the community if we didn't think this was serious, to stay home and to follow all these directives.
Paul Rivera with Channel 2. This is...
One more, Dr. Pino.
I was happy not to. So, you know, in support of the three prior speakers, the sad part could be that next week I could be announcing that there are cases that are related to that event out there. At some point in Florida, 50% of the cases at some point were related to political rallies that took place in Palm Beach and Miami. And it's not a coincidence that those cases, those areas are one of the harder hits in the state because there are a high number of initial cases that took from there. And in Orlando, we experienced a couple of cases from those events. And those were our first cases, if you remember correctly, a female and a male. And the idea that science is not supporting these. So there are news today that those couple of states that have not adhered to the stay home order, have experienced an increase in the number of cases, while the other states that has stay home orders, the number of cases continue to decrease. And to that effect, if you recall, a week ago, maybe 10 days ago, we were duplicating cases every 48 hours. And due to the measures that were put in place 3 weeks ago, right now we have a significant deceleration of the number of cases. Like in a week, we have seen 20, 30 new cases, when we were seeing 100 cases a day or every other day a couple of weeks ago. So the science is there. They don't want to believe it. It's fine. We just hope that they don't have a price to pay for that.
Paul Rivera, West 2 News. This would either be, I guess, for Mayor Demings or the sheriff. When is the curfew going to be up? And do you anticipate lifting the stay-at-home order before you reopen businesses? And if not, why?
I think the curfew will likely remain in place as long as we have a significant number of businesses that are closed down. It is put in place to ensure the protection of property as well as individuals during this period of time that we remain under a state of emergency.
Lara Greenberg, Fox 35. Regarding the crowd outside, I understand that they have the right to peacefully protest, but why isn't there any enforcement of social distancing guidelines within that protest? Is that something that's even doable?
Well, what I will tell you is that much like what we have said repeatedly during these various press events, we have asked for voluntary compliance regarding the social distancing. We don't have any orders specifically in place regarding the types of public assemblies where First Amendment rights are being discussed or exhibited. So we want to have voluntary compliance. Now, they could cross the line at some point, and that would be a decision that law enforcement will have to make if they truly impede traffic, or they're truly disruptive, or they're jeopardizing the life, health, and safety of others. It may be a bit debatable at this point whether or not they are truly doing that or not.
So I'll just add again that, as law enforcement, we're not going to get in the middle of someone's right to protest. And, going back to when I was chief and now sheriff, I think we've been pretty consistent in this community about the folks' right to protest, the right to free speech, and really we have not got involved and made arrests unless there has been a danger to the public, unless there has been property damage or significant disruption to major roadways due to traffic. So until that happens, you won't see any enforcement action.
Okay, we have one more question.
Yes.
Steve Hudak.
Thank you. I'd like to give a shout out to Miles here, who's been doing the thing with the microphone. He's masked up. So what I wanted to ask you, Mayor Demings, is after the announcement of the economic relaunch recovery task force. Yes. There was some reaction right away on Twitter. And one of the things that we've received is, here's someone who said, honestly, the folks on the task force are not impacted in the ways so many Orange County residents are, and yet they are going to decide how we proceed. Where are the community voices?
Every one of those persons on that task force is impacted by this virus. They are residents of the county, and they represent certainly many different business segments. So they represent the constituency, and that's why we've been pretty intentional about making certain that that was a diverse group of individuals. And their job is to look at the body of evidence of science and look at what works for businesses here and make recommendations to us about what it will look like when we begin to phase in the reopening of businesses. That's the best that we can do as a public entity, is to involve the people. We're not making decisions in a vacuum. We're involving the members of the public. And so I would say that all of them have been impacted by this virus, just like every other person. So I don't know that I agree with the notion that anybody has not been impacted, but certainly if you live here, you live in America, and if you own a business or you're an employee yourself or you're an employer, you've been impacted. So we're going to listen to them, take their advice. Yes.
Sorry, Mayor, just one more. It seems to many of us that some of the more Republican leaders are starting to open things up sooner or wanting to. Some of the Democratic leaders are wanting to hold off a little bit more. That can be very confusing to our community to know when it is safe for them. How do you go about helping people feel comfortable the way that you think is safe in leading this community? And are you frustrated by some of the politicalness that's come from this?
I'm not frustrated by that, actually, because this virus isn't about whether you're a Democrat or Republican or otherwise. It's just about human beings. And so what I will tell you, I know that one of my colleagues is here, Commissioner Gomez-Cordero, and all of us here, we care immensely about our community. We're trying to do the best that we can do to make decisions on behalf of the entire public, and we should make those decisions in an apolitical way. So whether the leaders are Republicans or not, the reason why I'm putting this task force in place is because sooner or later we do have to re-engage publicly with one another, and that should be a planned, orderly process, and that's what it's all about. What would dictate how soon or how late that is the science and whether or not it's safe to reopen or not. That's what would dictate it, not about your political affiliation or any of that. And quite frankly, for the most part, I really don't see that. Within the region, I have endeavored to reach across jurisdictional lines with the other counties here, Lake Orange and Osceola County. We have not had any conversations about our political affiliation or not. We're here to work together for the good of all of us. Okay. All right. Thank you all very much for being here this afternoon. We hope you have a wonderful weekend.